Thank you very much, Presiding Officer. The pandemic has been with us for 18 months now. But for some people in this chamber, it seems to only matter to them when it's politically convenient. Colleagues on the Tory benches are blithely switching between the health service being in crisis and at the same time furiously opposing public health measures that the Scottish Government enacts to help that same health service at this time. They can't sit both ways on this. Yesterday in his speech I said that we can't get back to normal, we have to get back to better, and that's what we should be doing. But this motion epitomises an attempt to make political capital out of a deeply complex and precarious situation. As legislators and policymakers, we need to allow for nuance, we need to consider consequences, and we need to seek expert opinion and listen to advice. Set a target date. Might sound good for a soundbite, but if one thing I'm sure of, the COVID virus isn't working to a Google Calendar. Yes, certainly.
Thank you.
Megan Gallagher.
Thank you very much, Presiding Officer. Does the member agree, though, that the BMA Scotland's comments in relation to not having enough GPs before the pandemic, do you agree with that statement?
Claire Adamson.
I do, and that's why we have set recruitment targets. But as Mr Doris pointed out earlier on, this is not a problem just in Scotland. It's throughout the UK and globally a crisis for recruitment in GPs. And the BMA have said that, but they've also said this is a clinical problem of ongoing need to protect vulnerable patients and staff from the risk of COVID-19. Current workload pressures within GPs mean that GPs, like the rest of the NHS, have to prioritise the time and meet the most urgent need. The BMA Scotland do not welcome an arbitrary target set by the Scottish Government. The Royal College of GPs has also said that it refutes as strongest possible terms any suggestion that the general practice has not been delivering face-to-face consultations throughout the pandemic. It's been said many times, but since some of the interventions would indicate people haven't read these briefings, I feel I have to repeat them. Face-to-face consultations have been provided to patients where they are deemed clinically necessary, usually following a telephone or video consultation. This has ensured that general practice can continue to provide care to patients to help protect the most vulnerable patients. We would not welcome an arbitrary target set by the Scottish Government to reach such a position. So that's the BMA and the Royal College of GPs. Presiding Officer, as someone whose sister is a retired GP, a fellow of the Royal College who still examines with them, when I was invited to take part in some projects with my local training GP practice, I was delighted to do so. And for a number of years, I've been working with my local practice, and that includes bringing GP trainees into this Parliament when it was possible to see the Health Committee, to come for a cup of coffee and or perhaps go for lunch and to have a conversation about how the work we do in here influences what their work will be in the future, and to show them the opening, welcoming interaction that we want to have with our colleagues in the health service. During the pandemic, I was involved in a video call with the local practice and other trainee practices, as Dr Logan, who's involved in this, is the NHS lead clinical tutor primary care. Then I learned that in 2019, of the 300 medical students in Glasgow, only 19 were choosing an elective in GP. That's 6% of them. This is an incredibly difficult, nuanced situation, and to just make political capital with it in this place this afternoon is lazy politics, and it does no good to our health service from the opposite benches.